Weird symptoms and atypical signs of diverticulitis explained. Have you ever felt unusual pain in your lower abdomen or noticed strange changes in your digestion and wondered what's going on? Could it be something serious like diverticulitis, even if it doesn't feel typical? Diverticulitis is often associated with classic symptoms like abdominal pain, fever, and changes in bowel habits. But what if your symptoms don't match the textbook description? Many people experience less obvious or weird signs that can make this condition hard to spot. For example, you might feel tired all the time, or even feel like your bladder isn't working right. These unexpected symptoms can leave you confused and worried. In this video, we'll break down the unusual signs of diverticulitis so you can understand what to watch for. We'll also talk about why these symptoms happen, how they're connected to your gut health, and what steps you should take if you suspect you have this condition. Stick around to learn how to recognize the hidden clues your body might be giving you about diverticulitis. Ready to uncover the mystery? Let's start with the basics, understanding what diverticulitis is and why it happens. Diverticulitis begins with small pouches called diverticula that develop in the colon's walls. These pouches are quite common, especially as we age, and most people don't even realize they have them because they rarely cause issues. However, when these pouches become inflamed or infected, they can lead to a condition known as diverticulitis. This can cause significant discomfort and health concerns. The typical symptoms, like abdominal pain and changes in bowel habits, are often recognized quickly. But diverticulitis can also present in unexpected ways, which makes understanding its full range of symptoms crucial. Many people are caught off guard by these atypical signs, mistaking them for something else entirely. Knowing this condition develops and manifests is the first step toward recognizing it early and seeking the right treatment. Before we dive into the unusual, let's get the obvious signs out of the way. The most common symptom of diverticulitis is abdominal pain, usually in the lower left side of the abdomen. This pain can start out mild and get worse over time. Alongside this, people often experience fever, nausea, and changes in bowel habits. You might feel constipated or notice diarrhea. These symptoms are the ones doctors are trained to look for because they're the classic signs of diverticulitis. But the condition doesn't always follow the rules. While some signs are subtle, others are so unexpected they're often mistaken for unrelated issues. Here's where it gets tricky. Not everyone with diverticulitis will have the classic symptoms. Sometimes the signs are downright strange, which makes it harder to diagnose. 1. Bladder problems. One of the most surprising signs of diverticulitis is bladder-related issues. The inflamed pouches in the colon can irritate or even press against the bladder, causing urinary problems. You might feel the need to pee more often or experience pain while urinating. Some people even report blood in their urine. In severe cases, a fistula, an abnormal connection, can form between the colon and bladder, leading to recurrent urinary tract infections or UTIs. 2. Pain in unexpected places. Although abdominal pain is the classic symptom of diverticulitis, it doesn't always stay confined to the lower left side of the abdomen. Some individuals may experience discomfort in areas like the lower back, groin, or upper abdomen. This occurs when inflammation spreads, or if the infection irritates surrounding tissues and organs. In some cases, the pain can be mistaken for other conditions such as kidney stones or appendicitis, making diagnosis a bit more complicated. It's important to consider all possibilities when assessing symptoms. 3. Unexplained fatigue and weakness. Fatigue is a common but often overlooked symptom of diverticulitis. When your body is fighting an infection, it uses up significant energy, leaving you feeling exhausted. Additionally, anemia, which can result from blood loss in the stool or internal bleeding, may contribute to feelings of weakness and tiredness. You may not immediately connect these symptoms to a digestive issue, but they're often a part of the broader picture. Recognizing these signs can help you address the condition sooner and manage your health better. 4. Bloating and gas. Bloating and excessive gas are often overlooked as minor issues, but they can be early signs of diverticulitis. The inflammation in the colon disrupts the normal digestive process, leading to trapped gas and a feeling of fullness. While these symptoms are common in many digestive issues, if they persist or worsen, it's important to investigate further, as they may indicate diverticulitis or another underlying condition. 5. Skin and joint issues. Surprisingly, diverticulitis can cause skin rashes or joint pain in some individuals. These symptoms are connected to the body's immune response to inflammation in the colon. When the immune system is focused on managing the gut's inflammation, it can sometimes cause reactions elsewhere, such as skin issues or joint discomfort. This is similar to other inflammatory conditions like Crohn's disease, where the immune system's overactivity affects multiple areas of the body. 6. Emotional and psychological symptoms. Diverticulitis doesn't just affect the body, it can impact the mind as well. Living with chronic or recurrent diverticulitis can be stressful, leading to anxiety and depression. Some people feel a constant worry about their next flare-up, which can interfere with daily life. The condition can also make you feel isolated, especially if you're dealing with embarrassing symptoms like frequent bathroom trips. In some cases, diverticulitis can lead to serious complications that have their own set of symptoms. One such complication is abscess formation. This happens when pus collects around the infected diverticula, leading to persistent fever, severe abdominal pain, and a general feeling of malaise. Left untreated, abscesses can become larger and even more problematic. Another serious issue is perforation, where the colon wall tears. This can result in peritonitis, a dangerous infection in the abdominal cavity. The symptoms are sudden and severe, including intense pain that requires immediate medical care. Additionally, bowel obstruction may occur. This happens when inflammation or scarring blocks the colon, leading to severe constipation, vomiting, and abdominal swelling. Each of these complications adds a layer of urgency to identifying and managing diverticulitis effectively. When to see a doctor. Listening to your body and recognizing when symptoms escalate can make a significant difference. While mild cases can often be handled at home with rest, antibiotics, and a temporary liquid diet, more severe instances need prompt medical attention. If you experience persistent pain that doesn't ease, a high fever, or notice blood in your stool, these could be signs of complications. Don't ignore these warning signals. Additionally, if your symptoms include vomiting, severe abdominal swelling, or an inability to pass stool or gas, seek medical care immediately. Acting quickly can prevent the condition from worsening and ensure you receive the treatment needed to recover safely. Preventing diverticulitis might not always be possible, especially if you have a family history or other risk factors. But there are steps you can take to reduce your risk. One of the most effective ways to lower your risk is by eating a high-fiber diet. Fiber helps keep your digestive system running smoothly by promoting regular bowel movements and preventing constipation. Foods like fruits, vegetables, whole grains, and legumes are excellent sources of fiber. Staying hydrated is another important step. Drinking plenty of water helps your colon process fiber more effectively, ensuring that waste moves through your digestive system without causing strain. Regular exercise also plays a key role in digestive health. Physical activity encourages healthy digestion and reduces the chances of constipation, which can contribute to diverticulitis. Listening to your body is essential too. Don't ignore bathroom urges, as holding in bowel movements increases pressure in the colon, which may lead to the formation of diverticula. Lastly, avoiding smoking is crucial. Smoking has been linked to a higher risk of diverticulitis and other digestive issues. By following these simple guidelines, you can help reduce your risk of developing diverticulitis. Living with diverticulitis requires careful management and collaboration with your healthcare provider. Regular checkups, dietary adjustments, and possibly medications are key to controlling symptoms and preventing flare-ups. It's important to track any changes in your symptoms and communicate openly with your doctor about how you're feeling. The sooner a flare-up is detected, the easier it is to treat and manage. By staying proactive and following your healthcare provider's recommendations, you can reduce the impact of diverticulitis on your daily life and maintain your overall well-being. To wrap things up, It's important to recognize that diverticulitis can show up with more than just the typical symptoms. Understanding these unusual or less obvious signs can help you take action sooner and seek medical advice when needed. Being aware of how your body feels and staying informed about potential symptoms can make a big difference in managing your health. Always remember, if something feels off, it's worth talking to a healthcare professional. Thanks for tuning in, and take care of yourself.